Bismillahirrahmanirrahim. Welcome to Medical Globe e-learning. This is Muzdalim from Shahida Islam Medical College. Now today's our topic is posture and gait. First of all, see it shows here are 7 MCQ and 2 SCQ from lower limb. Now starting our chapter, first of all, standing at ease. This paragraph is important for MCQ point of view, and our SCQ is the gait cycle. You have to know about its stance phase and swing phase and the muscles involved. Then energy utilization, it is important for MCQ. Then this table is important for MCQ and SCQ point of view. And here are some important MCQ highlighted with yellow. This one. And next we move on to the anterior and medial region of thigh. First of all, here are some muscles of the anterior thigh region. And you have to know that the anterior thigh muscles are the flexors of hip and extensors of knee. You have to read all these muscles once for MCQ point of view. This one. And you have to know that sartorius is also called as talar muscle and it is the longest muscle in our body. It is important for MCQ. Now this table, it is important for muscles of the anterior thigh, that is flexors of the hip. You have to know the muscles, their attachment, innervation and action. And this one is the extensors of knee, same. You have to know their names, origin, insertion, innervation and their actions. Now next one is the quadriceps tendon, also known as patellar ligament. It is important for SCQ and MCQ point of view. You have to read this highlighted paragraph. And again here are some important yellow highlighted points. And this one articularis genu, it is important for SCQ point of view. Then we move on to the medial thigh muscles. You have to know that rector magnus have dual nerve supply. This one is important for MCQ. Now this table 5.4 is important for SCQ and MCQ point of view. Muscles of the medial thigh. And here are the adductors of thigh. You have to read it for MCQ and SCQ point of view. This one. And next our SCQ is pes and syrinus. It is important for SCQ point of view. Adductor hiatus, it is also important for SCQ point of view. You have to know that which structures pass through it. Next one is the femoral triangle. It is very important for UQ point of view. You have to know its boundaries and its contents. This one. And next our SCQ is the retroinguinal space. You have to know about it and its clinical importance. Next, this diagram is important to see the femoral sheath, femoral canal and their contents. Next we move on to the femoral nerve. It is also important for UQ point of view. You have to know its origin, course and distribution. Femoral sheath, it is also important for SCQ point of view. You have to know how it is formed and which contents are present in it. Femoral canal, it is also important for SCQ point of view. And then about femoral ring, its boundaries and its content. Then femoral artery, it is very important for UQ point of view. You have to know its origin, courses and its branches. This diagram is important to see the arteries of the thigh. This table is important to see all the arteries and their distributions. Now femoral vein, it is not as such important, but you have to read it. Next is the adductor canal. It is also very important for UQ point of view. You have to know its boundaries and its content. Now we move on to the clinical box. First of all, psoas abscess. It is important for SCQ point of view. And next one is the chondromalacia patella. It is also known as runner's knee. It is also important for SCQ point of view. Patellar tendon reflex, it is important for MCQ and SCQ point of view. Groin pull, it is also important for MCQ point of view. Laceration of femoral artery, it is important for MCQ point of view. Next one is the femoral hernia. It is very important for UQ point of view. You have to know how hernia is formed and why it is common in females. Our chapter is end. Also you can understand. For better preparation of Prof, you can avail services from Medical Globe Book MBBS Cracks. Thank you. Allah Hafiz.
Medical Globe introduces its series of successful publications, MBBS Cracks, the benchmark of all, containing all the chapter-wise questions of prime importance, all annual and subtly solved university questions to ace your vivas, chapter polls, and of course, we have incorporated all the labeled and histologic and anatomic models in high resolution for your distinction level OSCE preparations. Medical Globe has also launched a gem in the medical world to master every concept for your multiple choice questions, the MCQ cracks encompassing UHS, NAMS, and many others, revealing the UHS MCQ rank, your practice MCQs, and topic-wise MCQs. Get your MCQ and MBBS cracks at your doorstep by placing your order at 0335 66 33007.